She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fisher Said podcast with your host, Lisa Fisher.
All right, Dr. Flynn, I'm a big stan. That's what the kids call it when you're a follower of something. And it's of your social media because you tell it like it is when it comes to health. As a chiropractor, what gave you this alternative bend? And not really alternative, but sensible, using common sense to address our health issues. What started that with you?
My own personal journey. And the only thing that really separates some of the things that I'm doing compared to like conventional medicine, I think they both have a purpose, but you have to approach it with a different way of thinking. For example, I've created the example to where I talk about how can we differentiate the thinking that way. And I've always said, hey, listen, and if I can perpetuate these ideas and let people have these ideas think in their head a little bit, it makes common sense. But then on top of it, it gives them some practical views to actually take care of their own health. And let me give you an example. I've always said that if we view healthcare from two standpoints, I think we can answer the questions of what route we need to take. And I believe that the majority of people have very simple common sense to actually direct their own health. But when they are used for fear and manipulation and things like that and confusion, people don't know what to do. So I said, listen, if I can come up with an example to give people some good guidance, it doesn't matter if it's COVID, it doesn't matter if it's hormone problems, it doesn't matter if it's cancer, they're going to be able to make some choices themselves. And I said, listen, if we can give the example, because I love analogies. I think one of the greatest things that have happened to detriment to patients is we've walked into doctor's office. They seem like they're really smart, but you leave and you're so confused, but you just think they're an expert. So you just listen to them. So I didn't want to take that route. I said, listen, I'm going to create analogies and things like that people can actually have a wonderful way of logically walking through this. And then if they do walk through it, it'll be by their own choice. It won't be by fear, manipulation, and control. So I said, listen, let's classify medicine like the fire department, okay? We know that if somebody has a big house fire, the fire department is the best professional to show up. They're going to use their tools, axes and hoses to put it out. But during the process of putting out that fire, they do cause some destruction. But thank God if they get there on time and do their job, they save the house. But through the process of saving the house, there's destructive things that happen, and you could never stay in the house and live there until it was rebuilt. Yeah. Well, guess what happens? You're going to call a different professional with the same house, and that's a carpenter. A carpenter is going to walk in, and even though it's talking about the same house, the fire department's going, man, look I saved your house. But the carpenter has a different perspective, a different way of thinking, going, it's a wreck in here. I need to bring in all this good raw material to rebuild and actually get your house back to normal. And they both have two different ways of thinking approaching the same house, but they're both needed during specific situations. For example, let's relate that to healthcare now. If somebody has a heart attack and stroke right now, thank God that your house just caught on fire. And we do have a system like drugs or surgery, axes and hoses to put it out. But there is destructive processes that happen while they're trying to even save your life. They even know it. That's why they have side effects. Now, the idea is this, and let's say the doctors did a wonderful job. Thank God we have great surgeons and great people that do save lives in different emergency rooms. But then here's what happens. People that did a great job of stopping the house from burning down, but you still have a burnt up house. And you may be able to go on and have your house go on, but you're going to continue to rot. And so a carpenter doctor, somebody like me, needs to come in and say, how to rebuild this? What do we need to do? Yeah. And so what happens is I said, listen, so I can respect medicine from a standpoint of saving lives, but I just can't believe that you can build a house with an axe and a hose. There's no way that you can make a body healthy, which was what everybody wants, from a drug or surgery. So therefore, I just said, listen, I'm not going to try to put anybody's fire out or stop them from dying with an herb or an adjustment or anything natural. But guess what happens? But they can't rebuild the house either, but I can. So that's where the big difference is. So I said, listen, we need fire department doctors and we need carpenter doctors. I just decided to build a whole healthcare realm around being a carpenter type doctor. And that's why a lot of people that are searching for health, they make sense to them because they start to study health instead of studying fires, cancer, heart disease, diabetes, which are all preventable. Just like most fires are preventable. Yes, if lightning strikes your house, if you get hit by a car, you could be the healthiest person in the world. You're going to need some drugs or surgery. But see, this dominant form of healthcare being fire department healthcare, especially the last 3 years, has perpetuated thinking. And the only way they can get you to do it is by fear, manipulation, and censorship. Because the majority of people are very logical and will make the right choice if there isn't fear, manipulation, and force into it.
fear mongering has made people make decisions in the last 3 years that I never were even thought were possible. And without trying
Yeah.
to get shadow banned on a platform, I think anyone would know in what direction I mean that. But it also comes, so women really are sometimes at the mercy of these providers because as I'm a health coach, I obviously do not give medical advice, but people
Yep.
come to me and say, you know, if this were you, what would you do? And for example, women in my age group of postmenopausal women who will have maybe vaginal bleeding, which is a
Yep.
little bit of a concern and alarm. It's not the fire. The house isn't on fire. It's just something to look at. It could be a fibroid or whatever. But when they go to their provider, the provider says, oh, we've got to do a procedure. You've got to go in. You've got to have a DNC or whatever procedure they do at that point. I don't know, because though it happened to me, I didn't have the procedure because I let nature run its course with progesterone. But
Yep.
it's always an urgency. This is what I resent about medical care right now, or for so many, is the urgency. Dr. Thomas Seyfried said it too with the cancer diagnosis. It's this urgency. You have to decide tonight. And that's what I wish that people would just, maybe they need to peruse your social media, because you talk about just about every topic, you know, known to man. But
Yep.
so let's talk about one of the things you just recently posted about. And it's about gallbladders and gallstones. That's another thing that women, especially I'm in the intermittent fasting community, people will lose weight. Sometimes they might get some gallstones from it, right? And then everybody's running out and ripping out their parts, which I want to have a bumper sticker that says, keep your parts. And everyone will know what we're talking about. Just keep your parts. So
Yep.
don't you see that there's sometimes your house is on fire, you've got gallstones, and it's really not. I mean, it may be a little warm in the kitchen, but your house isn't on fire. Address that.
Yeah, so I can give you both scenarios. Being in practice for 24 years, and I have hundreds of doctors that work for me and clinics all over, so I have a lot of experience, and also a lot of experience with my doctors coming with certain situations. I can show you, and I said, so let's go to both extremes. I can show you a situation where I saw a film the other day where the gallstones were so large they show up in an X-ray. That's a bad day.
Wow. Yeah.
And so therefore, it's going to sound quite funny about this, is I said to him, I said, listen, they need surgery. They need to have it removed.
Okay.
Now, coming from me saying that,
Yeah,
patient's
that's
like,
something.
said, holy crap, because I'm trying to avoid that in every single way.
Yeah.
But what I did say to that woman after I talked to her on the phone, because she was a patient of one of my doctors, okay, from actually in Florida. But I wanted to call her up because for me to say something like that, because remember, my job as a provider, just like you, as a health coach, is you want the best for everybody.
Right.
And I said to her, I said, listen, I said, how old are you? She's like 57. I said, do you have kids? Yep. Yeah. She goes, I even have grandkids. I said, can you do me a favor? Because you have influence on the generations beyond you. Can you do me a favor? And the things that I'm going to teach you, can you teach it to your daughter and your grandkids so they don't end up like you would do at 57 years old? Because we all try to blame things on genetics. It's not genetics. Because what happens is, once again, the genes respond. And yes, if you pass a gene on that will respond the same way, you just pass the bad habits that led you to have all those stones in the first place to your daughters and generations down, because we do follow family patterns.
Yeah.
You know, you see that a lot in the South, okay? You know, telling a person not to eat certain things down in the South, but we've been eating it for a long period of time. Yes, but you're sick and you're overweight. I think you should make some change, okay? Yeah. But the idea is this, and so I looked at her. Now on the flip side, the majority of gallbladder surgeries are done because there's not education and understanding about the gallbladder. Because if you look at it this way, we so downplay the role of the gallbladder because we think it's a storage unit. Now that's one part of its job, but it's not the most important job. The most important job, it's really a sensory organ. If you look at the neurological tissue that is within the gallbladder, why does it have so much neurological tissue? Because it's a sensory organ that says, hey, listen, there is healthy fats or fats coming into my system that I now need to recognize and release bile, and therefore now can emulsify and break down those fats into short-chain fatty acids and other fats. So now they can be used for building blocks of the body or even energy sources. And if you remove that, now you take away the major sensory organ that does what? That says, I need to make sure these things get into our system. And so when they say that there's no negative side effects or you can live without it, that's really misleading, because taking away a sensory organ that recognizes that when something happens in the body, and all has to work synergistically, because now when it doesn't, the liver doesn't know when to release bile into the system. So a lot of times the liver has to just dump it. So it dumps a ton of bile into the system. And next thing you know, there's a release of bile, and bile is like a slip inside. And that's why if you look at one of the negative side effects of gallbladder surgery is anal leakage.
Right.
Now, why? Because if you dump an uncontrolled amount of bile within the small and large intestinal tract, guess what happens? Is now it will pass through, and sometimes you will actually leave rectally because it slips right out. On the flip side, people do not realize this either. Bile is very antimicrobial. It keeps the small intestine from having a lot of small intestinal bacterial overgrowth from SIBO. When you have uncontrolled release of bile within the system, you can throw off your microflora. So that's why you see some post-gallbladder infections on a regular basis, because you get an imbalance of your normal flora because the liver just dumps out at inappropriate times. So really downregulating the importance of the gallbladder as a sensory organ. Yes, it does store bile and it knows what to do, but you really downplay the incredibleness of like the pancreas and the appendix and all these things that they think that they can tell people to live without. I just think that's misleading. I think that's misleading the public, and I think that's not giving people the full information. And Durham, I believe I've personally seen hundreds of cases that need to be taken out. That surprises people when I say that, but I said, my job as a doc is to guide you. And if all of a sudden they give you bad advice or a bad opinion, I'm going to give you an opinion based on going, okay, listen, what's the best for you? And then you have to make the choice, but it should be just a person's choice regardless.
Well, it can be disease too. And that's what Mercola, when I first had a clogged duct about 10 years ago, and this is before I was really informed, and I was sent to the surgeon, and I would not go any further than that point. But in understanding, that's when Mercola said to do it was lemon juice and olive oil. Oh, and Epsom salts.
Yep.
I killed, I knocked it back like I was at a bar, and then I released everything from my gut. I mean, for years, right? But I remember him saying that there is still a percentage that are diseased that have to be attended to. So that's probably what you're talking about. But when you're talking about SIBO, which I also think is pervasive, I just feel like I have some clients that are dealing with SIBO, and they have their gallbladders. Do you think it's a good idea? I know this is not medical advice, but for people to take ox bile, even if they have a fully functioning gallbladder, but they might have some SIBO?
Well, got to remember, I would give a little different approach. Now, let me give you an example. Okay, one thing that causes the gallbladder to release a significant amount of bile not only is fats but also stomach acid. See, if you ever look at it this way, the majority of people get this wrong when it comes to the function of the stomach. People say, "What is the function of the stomach?" And the response right away is for digestion. Well, that's not really true. You don't need stomach acid to break down fatty acids. That's what the gallbladder and bile are for. Okay. You don't need it to break down carbohydrates. That's what the pancreas and certain enzymes are for. But you think of it this way, the main job of the stomach, which yes, it does break down proteins, you do need that. But the main job of the stomach is to sterilize everything that comes in there. Sterilization. That's why if you look at protein pump inhibitors, one of the main side effects is what? Infections. Right. Infections, because you take away the amount of stomach acid needed to sterilize what's going in. And remember, and the reason why you see so many immune reactions that happen that when something passes into the small and large intestine, because you can sometimes have infected, even organic, perfect food can still be infected, because let's say I had an organic apple sitting right here. If I eat that and I don't sterilize it going from my stomach to my small intestine, even if it doesn't have to be broken down, I now create immune reactions that happen very easily. And then also too, without stomach acid, you're going to start to actually get things fermented too early. That's why when people eat, they say, "Oh, look I'm so full." You did not eat 26 feet of food. You just start fermenting that food way too early, because when stomach acid opens up, it's like this. I love going to Montana. We have an office out there at Kalispell. They have the beautiful Whitefish Mountain. And you go up the top of the mountain, you ski. Imagine being halfway down the hill, and all of a sudden you turn on, there's a big avalanche coming down. You're not going to sit and watch the avalanche. You're going to head down as quickly as possible down that mountain. When stomach acid is released from the stomach into the small intestine, what do you think the bacteria do? They're forced down where they belong, which is more in the large intestine. That's why it's called the large intestine, because as fermentation happens, there is an expansion, which we want to be expanded. You want to ferment that fiber. You want to ferment that food. We produce B vitamins and other factors in there. So therefore, we have too much bacteria happen at the beginning. So yes, a combination of stomach acid, now bile is released. Now, Durham, I'm a very big fan of bile salts, ox bile, because even if you do have a gallbladder, now, because you know why, it gives your gallbladder, once again, it causes a little bit of stimulation. And remember, you do get bile sludge. you need to get it released, because a lot of people have gone vegan and you can't get a lot of good fat soluble vitamins, which are really needed to trigger the sensory aspect of the gallbladder. And so when people move more towards a vegetarian-based diet, I said, listen, you may want to take some bile salts, because number one, you need to stimulate the gallbladder to release some of that. But high stomach acid does a wonderful job, because bile also neutralizes the stomach acid as it comes in.
Well, then would you then recommend the HCl butane then for everybody? And
I
not
think
everybody, but I'm just saying a majority of people who are suffering with their gut.
I can honestly tell you that that's the most overlooked thing in all of natural health. Everybody's so worried about the small and large intestine and leaky gut. I'm like, listen, you're missing the amount of acidity needed in your stomach. And this constant basic stuff really drives me nuts. Because if your stomach is basic, you're going to be very sick. If you're drinking Kangen water at a pH, making it very basic, or you're drinking baking soda water all the time, it's going to be very devastating for your overall health. Too many people focus on leaky gut and forget about how important the stomach really is. And you can see a lot of conditions, including SIBO, including allergies, including a lot of things, just by having proper digestion of the proteins, because undigested proteins move in the small intestine, you're going to get more immune reactions. Undigested proteins move in your bloodstream, you're going to have major inflammatory things. Undigested proteins and unsterilized sugars and fats move into the small and large intestine, are going to create massive inflammatory things that are going to lead to leaky gut, and you just miss this aspect of the stomach. So everybody's running towards leaky gut, leaky gut, leaky gut. I'm going, man, if you just had good stomach acid. And stomach acid is changed so easily by even the amount of mental stress that both men and women have. Women are much more affected by stress than men are. Their hormonal system is very depleted by a lot of stress. Men are a little strengthened during stress, but both biologically, we both reduce stomach acid the minute that we move into psychological or physical stress.
Stress, boy, that's a whole hour or two topic. Another thing you mentioned in your social media is the sleep requirements are different for men and women. And every husband listening is thinking, oh, how does my wife sleep so much? And the wife's thinking, how do you sleep so little? So address that.
Well, if we look at just the basic circadian rhythm of both men and women, they're very similar. But if you look at one thing that men don't have to deal with compared to women do is hormonal reserves. So if you look at what it takes, and that's why I'm very big on women getting to bed between 9 and 10, because there's growth hormone that's released. There's a built-up of reserve of hormone that you guys need to build up more than we do. Our life is very good if we can stimulate some testosterone production. And we just need a little bit of brain hormone and specific cholesterols and some minerals, and we can produce hormones at a very high rate. Women do not have the luxury that men do of doing that. And a lot of those hormones start to build up in their reserves based on the sleep patterns and circadian rhythm. So I just looked at the circadian rhythm of women, circadian rhythm of men. I looked at the fact that what it takes for us to get our production and hormones, and guys really can get away with very minimal sleep compared to women. And so therefore I said, listen, as a doc guiding patients, I looked at women's health just changing just from getting good sleep. Do you understand? If there's one thing I would say that women need to take very seriously is their sleep, especially when they go to bed and when they wake up. They need it much differently than men. We cannot treat a male patient the same as we can treat a female patient. It biologically doesn't make any sense. And therefore, even how testosterone affects us compared to women, even how estrogens affect males compared to females, it's dramatically different. And the rate of demand on their cortisol compared to men is dramatically different, because women need higher level of progesterones, which now can be stolen by cortisol and everything. So I want to make sure that there's a cortisol reserve and everything being built up compared to men. Testosterone isn't directly connected to cortisol. So therefore, guess what? We can get away with a lot more than women can. Women need the appropriate time to build up hormone reserves so they can deal with the day, because their body will respond to it physiologically much different than guys ever will.
What do you think for women, let's say in their 40s, and even men, what lab work do you think is important? Do you like the saliva test? Do you like the Dutch test? Do you like blood work for men and women?
So what I did is, and do you mind if I tell a quick story about that?
We've got nothing but time.
Okay, good. Well, when I was young as a practitioner, my focus coming out of school was actually children, because my history was based on psychiatric things that happened to myself, and I figured out through nutrition and natural health how to get that back to normal. But then I sat back, as I still disagreed with everybody that the medical field was teaching, because by far, even since I was a kid, and I'm 48, it's been dominant, and it's gotten more dominant over the last 20 years. Yes. And we've seen that over the last 3 years. And they, with the exception of acute care, they give really bad advice. The medical profession gives really bad health advice. Sometimes they give great life-saving advice, but they give really poor health advice. So therefore, I started to look into the things of normalizing certain things, and then I met this woman that had endometriosis, and they told her that she couldn't have kids, and she was very sick. She was only 22 years old, and so what I did is I said, "Can I see your lab work?" And so she sent me her lab work, and therefore, all I saw in there was something that changed my life forever, because I realized that their view, especially when they even deal with certain conditions, when they're trying to manage your health or manage anything that way, their testing is extremely incomplete. Now, what do I mean by that? This woman suffered severely from ulcerative colitis, cystic acne, cluster headaches, and endometriosis. Well, when you in dominant endometriosis, we know this, even as a health coach, you know this. If we were to look at some of the basic hormones that are dominant, there's a little bit more of the estrogen. Mm-hmm. So I actually got her labs, and I realized that their view of hormones is extremely incomplete. Now, what do I mean? Well, I'm going to say a statement that's going to stimulate some thought, but I want you to run with me on this. I started because I've learned in my graduate degree and going through chiropractic school, I learned just like every other doctor does about hormones. But then what I realized was that the public and women today, and that's why it's going to freak women out a little bit when I talk about this, is not only are they dramatically misled when it comes to hormones, they're actually lied to. For example, we understand that testosterone makes me who I really am. Now, we have all the other hormones like women do, but there's a dominant hormone when it comes to women. And that's in women, if I ask women that, they'll say it's estrogen. And my response to them is quickly this: estrogen is not a hormone. It's not. It's not a hormone.
So is estradiol the hormone?
Okay, here's what happens. You're on the right track. Estrogen is a term that describes many hormones.
Okay.
So then what happens is this. So then when you see women's blood work, they measure 1, maybe 2. Well, that would be me trying to make a judgment on somebody's body with incomplete information.
Right.
Yet they're willing to change you hormonally and psychologically with medications with an incomplete view. So what I did is I looked at it, I said, "Where's the rest of your estrogens?" And she didn't even know what I was talking about. So I said, we have estrone, we have estriol, but then we have all the other ones that you can only get through the urine. So I started calling labs and said, "Can we measure this?" And the lab said, "Yes, we can, but why? And insurance doesn't pay for it."
Right.
And I said, "Listen, I have a woman who's suffering badly, who cannot have children, that is curled up in a ball every month when she gets her period." And that woman ended up being my wife of now 22 years.
Well, isn't that cute?
and we have 4 beautiful daughters.
It worked out fine. Look at you.
Yes, and that started my adventure of realizing that women are not getting their hormones tested properly. In 24 years, I still haven't seen it happen yet. Because in order to properly get their hormones tested, they need blood and urine together.
Okay.
And believe it or not, saliva to me is only really good if you're going to do bioidentical hormones, or for example, cortisol.
Right.
But you can get a better
that's
form
what I was
of
figuring. Yeah.
Yeah. But the idea is I'd rather see it done in the blood and urine, because you get metabolites and everything like that, even progesterone, even cortisol metabolites. Progesterone, once again, cannot be measured in the urine. Neither can DHEA. So therefore, you need a combination test. And so when I go speak at medical seminars or natural seminars or get interviewed, nobody disagrees with the assessment of how I evaluate patients, because I do the most complete testing that is done on the planet. And that's what made me popular on social media. And everybody comes along and a medical doctor goes, "Well, he's not wrong." And a health coach comes along and says, "Yeah, it's pretty darn good testing, this. Because I'm speaking universally of saying, listen, if we want to evaluate women properly in their hormones, why would we ever just measure a couple of them instead of having a complete view, which some of these metabolites and some of these other hormones can be very devastating, both physically and psychologically. So why are we leaving them out? Well, they're leaving it out because there's no medical treatment and insurance doesn't pay for them. Well, should that be why we assess women? Or should we assess them because we're trying to accomplish good health outcomes with them?
Well, I mean, we know that with all of big pharma, that's why I tell people to get a fasting insulin, because that, as Dr. Ben Bickman says in his book, Why We Get Sick, it's the most predictive thing about your health for 15 years even. And people ask me all the time, "Lisa, why won't my doctor test it?" I go, "Because there's no drug for it if your fasting insulin's high." Exactly. I mean, it's cause and effect. People follow the money. But now if we could then break down someone who, and we'll send them to your social media, can they order the blood work from you, or they have to, in their state, get their provider to write it, the prescription for the blood work?
Let's give you this example. Number one, you do not need any provider or any doctor to ever get you a lab.
Well, wait. Are you for sure on that? Then how is it? Why is it we have to practically arm wrestle somebody, kick them in the ovaries to get anything done around here?
Well, that's because everybody wants it covered by insurance.
Oh, okay.
Do you understand?
Got it.
See, that's the thing.
Again.
Like, for example, the blood work that I just wrote up right here, it's
Yes.
just simple. I know you won't be able to see it, but if you go to my Instagram, Dr. Patrick Flynn, and just any of my videos, type in BW, blood work, okay? You can take this to any lab. You can even take it to your primary provider and try to get them to cover it. It's just blood work, but it's very complete, as you can see, and I will just slowly, but I'll just tell you the values. For example, TSH, T3, T4, free T3, free T4, T3 uptake, cortisol, TGB, the TPO antibody, TGB antibody, ferritin, vitamin D, Pregnelone, DHEA, estradiol, estrone, estriol, sex hormone binding globulin, testosterone free and total, progesterone, DHT, fasting insulin, CRP, and the CBC and CMP. So if you look at it this way, that gives us such a global view, because here's what happens. From a functional standpoint of what's going on with the part of the body. Now, on top of it, this is still an incomplete view of a male and female hormones, because you need to get the urine work done to see hormones like 4-hydroxyestrone and estradiol. And most women are going, what are you talking about? What are those?
Are those the pathways, or is that part of the pathway?
Yes.
Okay.
Because a lot of women and men do not realize this. Production on hormones is really not the problem with most people. It's hormone metabolism to the right forms that they want to get. And usually some deficiency or toxicity leads to those things being off, which there's no medical provider that ever digs those. It's the health coaches and natural coaches like us and natural providers like us that are trained into dig into them. And then I happen to know, and I did this with all the labs, I even taught them what herbs and different things you can do to support those pathways. And that's what's made me kind of a little bit more known all over the world too, because doctors use drugs to manipulate those pathways. But what if I told you we could restore those pathways?
All right, I think we're all for it. I think women especially are so desperate, so hungry to be heard, to be recognized, finding someone who speaks their language. I think we're totally all on board. One thing you do mention there, and I still haven't understood its role, how do you say that word?
Pregnelone?
That one. I need to know about that. And the sex hormone binding globulin. I know that's an important marker, but I still haven't grasped it. So kind of be my teacher here.
Well, so if you think this way, pregnelone is the mother of all hormones. If you ever look at when you're going to produce a hormone, it's the first one produced, and then they're converted and metabolized into other forms. That's why it's called the mother hormone. And one of the major backbones for pregnelone is cholesterol.
Oh, I love cholesterol.
Let me say it again, cholesterol.
Yeah.
But we've been demonizing cholesterol for 50 years based on a bunch of fraud.
Right, and drugs.
Yes, and you got to remember, it's a billions, and we're talking hundreds of billions of dollars system that way. They're not just going to give up on it. And the concept of people say, well, doc, wouldn't you agree that some form of Apo B, a part of the LDL complex, is a contributing factor to heart disease? Yes, it is. But let me explain. So is some form of inflammation, and so is oxygen. Well, then instead of just lowering all LDL levels, why don't we just get rid of all the oxygen from somebody?
That's funny.
See, it's the same kind of concept. So they're wrong. And there are levels of LDL in the certain forms that need to make sure that they're regulated, but they just drop them all with statin drugs. So they're really creating a lot of health problems. And this concept, these integrative doctors saying that we need to drive LDL, we can do everything natural, but we need to drive LDL down as low as possible. Here's one thing where I think the natural world very differs from the medical world. And even some of the natural people don't understand this fully. Your body doesn't make mistakes. It doesn't. It doesn't make mistakes. See, even when I watch natural practitioners talk about autoimmune disease is where the immune system makes a mistake. It does not. It recognizes that tissue, even though you can't explain it, recognize it as unself. And because you don't have the tools and technology to dig and find out what's going on, you say the immune system attacks. No, you actually think that we're a broken down machine. If you understand the complexity of just the female ovary, you would understand that it's quite genius. What the body's trying to do is trying to adapt. If you ever look at if you want to live longer, get your body to adapt to all the stressors within the environment, internal and external, and that's how you regenerate, and that's how you live the longest you possibly can. Because if you can't adapt to cold weather, you're going to die. If you can't adapt to hot weather, you're going to die. Your body's in a constant form of adaptation, and most diseases are nothing more than a survival mechanism for you to adapt and live as long as possible. But the sad part is, during adaptation, you could create a crisis of fire. And that's where we look at like the body made such a big mistake. No, we don't. The body doesn't make mistakes. You do in how you treat it, and therefore it's going to respond to what you do.
Is there an alternative for people? Present company included with her high cholesterol, but again, low fasting insulin, low blood pressure is 100/70. I mean, all the other risks, but I love my high cholesterol. But my provider's now saying, well, why don't we look at your Apo B profile? Is that a blood lab work that I would have done?
Blood
okay.
lab work. If anybody makes a judgment on statin drugs or any evidence of dealing with cholesterol panel without an Apo B and other LDL markers, I believe, once again, is doing an incomplete view and an injustice to put a person on a medication that alters your liver, causes not only physical but psychiatric reactions as part of the side effects that way. Once again, I have no problem with medications if you understand the consequences of your actions. And the consequence, accept that this thing is normal, is misleading the public. It's misleading. I'd rather have people have all the information, but how can you give them all information when it won't even test what's needed for them to have a clear picture? And we know this in great detail. If all you have to do is look at Apo B and just look at its contributing, because once again, it's a protein that allows absorption within the vessel walls and stuff. And that's why you want to keep that at a better level, which is more of a marker of atherosclerosis than anything else. But on top of that, you could have a high Apo B and never develop atherosclerosis because you also need some inflammatory things and you also need oxygen. Do you see what I'm saying? So that's why I kind of laugh when they pick on LDL.
Yeah.
It's like in their own. And the majority, now I will say this, the majority, not all, but let's speak about the rules, not the exceptions, because what people like to do in healthcare is talk about exceptions. I'm like, that's not the rules. You know what I'm saying? Because there are, hypercholesteremia that does happen. That's that's an exception, not the rule. Okay. But if you look at your lipid panel in general, including Apo B, there's a significant amount of things that leave you in control to change that. If I can convince you that something is genetic and you're out of control, that means you have to come to this expert and only drugs and surgery can manipulate your body to make sure that you can survive. That is complete misleading. And for the small fraction that could possibly be possible for, don't generalize that to everybody. Okay. Second of all, here, if you look at just people say, well, doc, if you look at the markers, people say have high cholesterol. My first question is, do you have high TOL? Do you have high LDL? Do you have high HDL? Do you have high triglycerides? Because that does determine. Because here's what happens. A lot of people have a high panel based on just too much sugar consumption. Too much sugar consumption. Now, you'll see sometimes in statin medication advertisements, they'll say, if diet and exercise doesn't work, that can happen. And I say, doc, what do you mean? LDL can actually be elevated just from the demand of the production or regeneration of your body. For example, we know this. LDL is a major carrier protein that mobilizes cholesterol to all parts of the body. And so does HDL. It does the same thing. It's just that here's what happens with LDL. LDL has such, a variety of them, all down, even down to, it's called VLDL, all down to different sizes, and there's different particle sizes. But here's the point. Think of this. The body doesn't make mistakes. If you look at a cyclic woman, do you understand when you measure a woman's lipid panel should always be very consistent on where they are during their cycle? Because if there's a high demand for estrogens or if there's high demand for progesterones, remember I told you the major hormone Pregnelone? You need cholesterol. That means your body has to mobilize cholesterol into the bloodstream. Mobilize cholesterol into the bloodstream. Wait, say this again. Mobilize cholesterol into the bloodstream. So if it elevates, there's also a demand that your body needs cholesterol. And if you have any inflammation, you have any healing process, you have any demand hormonally, you have high stress, LDL can elevate. That's a life-saving thing. Now, yes, if you have high inflammation and you're damaging interior aspects of your epithelium, if you're vitamin E deficient, okay, in your arterial wall, you can have inflammatory things that all of a sudden that things are passing through there. And here's what happens. People, I want to give you a different perspective when it comes to plaquing. Okay. I love a calcium score. I do. I think a calcium score, which can only be done medically, it's a simple scan. Yes, there's radiation. I still think it's a life-saving thing. If you start to see calcification of the arteries, which is a very predictor of atherosclerosis, here's what happens. People, oh my gosh, look at the plaquing. Well, here's what happens. That's not good because it can build up and eventually clog an artery, and that's a bad day. But I want you to think about this. I want you to imagine this. I live in the country, and I have a wonderful garden. and you got to run the hose out there. And this happened literally the other day. And all of a sudden I turn the hose on, and all of a sudden there's a straight up little thing. Something poked a hole in the hose and it was leaking. You know what would have been really cool? If that hose had an intelligence like our body did and used something to plug that hole up. See, I would rather end up having plaquing than rupture the artery.
Okay.
Okay. Now, because the plaquing, do you think the plaquing just magically went there for unknown purposes? Now, Durham, that plaquing can build up and kill you. So you don't want to even have the situation of having plaque there. But don't demonize the plaque. That's like showing up at a crime scene and saying the cops did it because they were there first.
Huh.
You saying?
Yeah.
No, there's a crime scene. The plaque came in and said, I got to plug you. Otherwise, you're going to spurt, you're going to rupture, you're going to leak into the system. See, but we don't think this way. We think the body's not intelligent. So therefore, it's like, yep, there we go. It's like, no. No, they're wrong. If you continue the same habits that led to that inflammatory response and high levels of LDL and high levels of VLDL and things like that, it's going to be a bad day. But the idea is this, that to automatically demonize it and put you on a statin and say, listen, you have two choices. You're either going to change things dramatically, otherwise you are going to be on pharmaceuticals. And there's a certain amount of population that will always take pharmaceuticals because they're lazy as hell. Now, I know probably everybody loved that interview until I just said that right there.
No,
but you being a health coach,
it's the truth.
But you being a health coach, you understand that a true doctor, a true coach is nothing more than a guide. Because you know what happens this? We can go into the detail of testing, natural remedies, all these things. But if they don't take the action steps, there's nothing we can do. The concept of healthcare says, I am the expert. Just listen to what I tell you to do, and everything will work out. Really? Since when do drugs and surgery change that plaquing? Do you understand? Because even if you do this, if you take a statin, it doesn't reduce the plaquing. Well, it doesn't.
But what does then? That's what I was wondering. Well, let's say somebody goes for the CAC score and they do see something and it's not surgery. You know, they don't have to have a procedure, which the heart hospital is hoping you have to have that's what they're betting on.
Sure.
But how do they reverse the plaquing?
Well, here's what happens. Think about this. You have to ask why the plaquing get there in the first place. As you know, there's one thing that every health coach, medical doctor, natural doctor, chiropractor, osteopath, foot doctor, dentist will agree upon. The start of every condition has some inflammatory response.
Right.
So it's very important to dig to every patient's inflammatory issues. Now, for regeneration and repair, we know this. Your vitamin E is extremely important for the regeneration inside your epithelial lining. Nitric oxide is. Okay. Also, here's what happens. People do not realize this. If you look at the combination of bone density, if you look at even plaquing itself, there is actually forms of calcium in there. That's why the calcium score test that's why it shows up that way. Because the artery is actually hardening. But if you ever think this way, what is the major fat soluble vitamin that helps you determine where your calcium should go?
Is that E?
Your vitamin K2.
Oh, that's what we take with our vitamin D.
Right, because vitamin D, once again, and I will give Mercola some great thing about this because he really brought vitamin D to the world. But what they did is they started to give in vitamin D and it starts to mobilize a lot of your calcium. And that's why they talk about hypercalcemia. And then what ends up happening is this. Now, it can, no joke, and if you just take vitamin D alone, you could end up with a kidney stone if you have some kidney damage or sugar's too high. So what they did is they started adding K2 because vitamin D mobilizes the calcium, but K2 helps you get it to where it belongs. So most people are very K2 deficient in their diet because they're not eating sauerkraut and other fermented products or fermented raw cheeses that are fantastic for you, because most people have a standard American diet, the SAD diet, which is very deficient in our fat soluble vitamins. They're missing vitamin D, vitamin A, vitamin K, vitamin K2, vitamin E. And so therefore, we set ourselves up for inflammatory things and also deficiencies that lead to arterial disease. And now you have oxygen and LDL coming around, and now it's a bad day. See, so that's why you need to be guided by somebody that's actually a good person that understands not only the fact that, hey, listen, always think about this. If there's a fire and you have a heart attack and stroke, do every drug and surgery you need to stay alive. But then once you are stable, please do me a favor. Find a carpenter type practitioner and work on rebuilding. And working on rebuilding takes that person and you together. There is no one-way street. I would tell people, I'm a tour guide. Jump on the bus, I'll give you the greatest tour in your life. But you still have to get on the bus. I can't make you get on the bus.
It's the getting on the bus that sometimes gets pushed back from family members because they think you're wacko, you're not because you're not following a conventional route. So
Well,
I do understand people get pushback from peers.
Lisa, let me interject you on this. So I got interviewed when Robert F. Kennedy Jr. and Andrew Wakefield came out with their fertility movie. Okay, and I was the last practitioner. They had medical doctor, had this, and then they had the lonely chiropractor. Now, once again, my background is also immunology and also nutrition. And my postgraduate work is nutrition, immunology, and things like that. So yeah, people can argue my education a little bit that way, but here's the point. You know, and it's cool. They put me at the end because here's what happens. I even said this. I said, whenever you can't argue the message, you have to argue with the messenger. And so therefore, you saw that even over COVID over the last 3 years.
Yeah.
But I have a simple question for everybody. If they're so right, how are we doing? Heart disease, diabetes, cancer, infertility, infections, everything go up every single year. I've always said this. The medical field and the weathermen are the only two people that can be dramatically wrong all the time. People still go back for their advice.
Yeah.
You see? And so therefore, just look at what we're doing. If they're so right and I'm so wrong, how are we doing? I always tell people, I started out with one office and $500 in December 27th, 1999, with just all these ideas of physiology and function. I really haven't changed practice in 24 years. The only thing that's really changed is some labs have come out to give us a little better evaluation of some things. But as far as the clinical realm, because the function of the body is always the same, it's always normal. We know what happens during fight or flight. We know what happens during biochemistry of female and male hormones. We know this stuff. But here's the point. The stuff I'm talking about would not be even existent if they were right. You and I and other people that have a different perspective exist because they have failed dramatically. If you don't believe that they have failed, look at what we've done. And where people try to defend them is they look and go, but the doctor saved my dad's life. Yeah, but the doctor that led your dad to develop all those conditions was in the same field that actually caused your dad to actually need them to actually save their life 50 years later. If they'd been listening to me or you or somebody else guide them, the rate of that kind of illness would not only be prolonged, because everybody eventually is going to get some disease and die. It's just that when you look, when I was a kid, grandma and grandpa got sick. When I started practice, type 2 diabetes was called adult onset. Within 5 years, they had to change that because it was moved down to younger generations. So if you guys are so smart, why are we so busy? And why are we getting clinical results where you are not?
Well, it's also the mouthpiece of the other side, meaning people, big pharma, big food is so loud that my father-in-law is watching CNN, literally so loud that when you call him, that's all you hear. And he's the one that says, run for the hills. You've got to take a statin and you have to take a COVID vaccine. It's because of the message. And I do think younger generations are more skeptical and have more cynicism to say, you know what, that hadn't really fared well for us. So maybe I am going to try something else. So maybe there is hope for our future with younger generations.
Yeah, and if you think of it this way, you've been doing this for a long time. So I started fighting back in college for healthcare freedom. I do not like people saying medical freedom, because medical is actually the opposition where you're going against. Healthcare is not medical. Okay, healthcare is healthcare. So when people say, I'm fighting for medical freedom, I said, why would they already have freedom? Stop fighting for them. Start fighting for healthcare freedom.
They do, yeah.
Because they're trying to do medical forcing, not medical freedom. Okay, because if you choose medical as your healthcare, you will end up a statistic like 1 out of 2 you will end up with heart disease, 1 out of 3 you end up with cancer, 1 out of 4 you end up, majority of people are obese and not doing things they don't have right. And see, that's what I tell people. And people say, well, you come off a little bit, angry. I said, listen, you should be angry. Over the last 3 years, they tried to force something that now is causing massive blood clots. And one of my favorite doctors, who I know and respect massively, is Dr. Peter McCullough. Go see what happens to him. And he's publishing paperwork on massive blood clots and all these problems. You don't have to be a rocket scientist to understand that when you stick something inflammatory in the system, that even tell you that's inflammatory. And all these negative things happening that way, it's just that what happens is this. We've so led and we've been misled by people thinking they're experts. You know how you become an expert? Someone just says you are. That's it.
That was easy.
That's it.
Right.
No joke. Look at it. Say you're an expert. Well, where'd you go to school for an expert? You didn't. Someone just says you are. That's it. See, that's why it's kind of funny. It's like people give you that title. It's like, no. It's like, and remember, and I always tell people, how are we doing listening to those kind of experts? If they were so right, why are we so sick? Oh, and see, I said, and then they ended the movie on that way, the documentary going, hey, listen, it's true. If they're so right, why do we have more? Whenever healthcare that we currently have moves into other countries, it gets worse for them. But see what
Yeah.
they do, and here's their thing. But they saved a life. Well, great. I think we should have emergency rooms and then practitioners like us.
Yeah. Right. That's right. I totally agree. Now, I've been a part of the fasting religion since 2017. How long have you
Yep.
been a part of our club here? Because I noticed you did push the 72-hour fast, which I try to do a couple times a year.
Okay. I'm happy you said religion. Okay. I would in my whole career, I've never encouraged a woman to go over 18 hours of fasting. I think it's detrimental to their health. Okay.
Oh,
Now,
what?
I know. You have to watch the material when it comes to fasting that way. Because here's what happens. Let's go back to this. I think it's essential for males to do it on a regular basis. I think that but let's go back from here's the standpoint. Whenever you look at what happens, now remember, you know this, so I'm going to walk you through this. The minute you start passing that 18-hour mark, as far as fasting, what hormone starts to elevate to make sure that your blood sugar stays normal within your system?
Cortisol.
They know that. It's simple biochemistry.
Right.
Now, here's where what I taught you before, and this is what made me biologically, and you know this because you already said the Dutch test. You always said you. And here's one thing I want to correlate with you. Whenever cortisol goes up, it has an inverse relationship with progesterone.
Right.
And you understand that progesterone not only is needed cyclically, that's why when women fast or in the wrong times or go for extended period of times, they start to lower their hormones. So therefore, a lot of women, because of the obesity epidemic, they actually, have enough fat to compensate for it.
Yeah.
But relatively consistently, women fasting for over 18 hours. And remember, and I tell people, fasting, once again, is not time-restricted eating. Time-restricted eating is different than fasting. Fasting, you have to go a significant amount of time, 24 to actually 72 hours, to truly be your body be in a physiologically fasting state.
All right. I see that.
Okay. And because people don't realize this, the transit time is something when you eat something, it takes anywhere from 24 to 72 hours. So you could eat something right now and you're still eating for the next 72 hours. Okay. Yeah. So that's why I tell guys you need to fast for at least 72 hours because when they do fast, once again, there is massive benefit to a guy's body. Now, I think time restricted eating for women is fantastic, but here's what happens. You know this. If you did a cortisol test, either by Dutch test or even by saliva, and you have elevated cortisol in the morning, ladies, the last thing you want to do is fast in the morning because you know why? You're going to drive your cortisol up and you're going to steal from your hormones. You're going to lower your anabolic hormones. So it's very difficult for me to watch women fast for a long period of time because then they may see weight loss. They may see other things because cortisol does jump up and you do have mobilization of fat. And you get to use that for energy. But the sad part is this, when I've actually had women fast because they had an ulcer or something, I also let them know that could throw off their cycle, could deplete some of their hormones, and it did. And so I just have a very hard time encouraging women to go beyond time-restricted feeding due to the fact that it's going to deplete their progesterones, especially if they're cyclic. Do I think that menopausal women can get away with more time-restricted eating and fasting than a cyclic woman? I do, because they need less progesterone, but they also have less to give away too.
Yeah. And maybe that's it. I didn't join the cult until I was postmenopausal. And so I hadn't seen any problems, but I've heard Dr. Mindy Pelz talk about her Fast Like a Girl book and series that she talks about. It is looking at where you are in your cycle. So I do want to make sure that people recognize that. Right. And the other thing about cortisol is it also makes us insulin resistant immediately. And so that could then be, it could be counterproductive for somebody who's trying to get into the fasted state, yet they're pushing out too much cortisol, which pushes their insulin up, which makes their blood glucose go up. So I can see that.
And that's why I think women have to really get their cortisol levels tested for the 4 samples. I believe that they have to get their hormones tested. Now, they're wrong. If you have something like PCOS, I'm going to have a person time restrict feed a little bit longer because you need to drop, you need to drop those sugar levels, which is important. And see, that's what it is. It's case by case. The aspect of everybody fasting the same way to me is doesn't make any biological sense. And once again, and men can get away with a lot more bad stuff than women can. That's why I've really focused on women's health and trying to give them the detail that they needed because they have a lot more complications than men do because when their hormones go off, there's a lot more physical and psychological things that can change. And as women, and here's one thing that I learned at a young age, obviously because of my wife and studying hormones the way I did, is women's hormones change 4 times in a month. That means a woman that's cyclic, she's going to have both physical and mental things that change every single week. That's why I tell people a woman's going to have physical changes like their breast size changes. Their butt size changes every single week. That's why a woman judging their weight by their scale isn't a good thing to do. Second of all, they're going to have psychological changes. That means a woman is going to have emotional changes every single month. And that's why when women come to me and say, Doc, I feel like I'm unstable, I said, welcome to be a woman, because there is no such thing as a mentally stable woman. It's impossible. It's physiologically impossible.
I'm not offended by that statement. I support
Yeah.
that statement. That
It's true,
during our cycle, there are 4 women that lived inside this body.
Yes.
Because that first week
Yep.
you feel great. The second week, by the time your period starts, I was a raging lunatic. I don't know about the rest of you.
And to go back to the fasting thing, because I want to comment on this, I've been doing this for a long time. And there has been, Dr. Minnie and other people that have looked at my stuff. And I was the first person, honestly, to ever teach people how to exercise during their cycle, how to eat during their cycle. Because remember, if you understand, as a woman's hormones change, her nutritional demands change every week.
Yeah.
That's why when people tell me that they have the same thing, but guys, a woman's exercise, their food, all things have to change every week. And that's the detail of a woman when they're cycling. And that's why we see so much infertility, because we're trying to do the same things all the time to a woman. A man's hormones actually stay very stable through the month, so they don't need to do as much changes. And so then you throw in the mental stress. There's times that women have to be very careful of their mental and physical stress to their body, because they can deplete their hormones. So that's why, if you think about it this way, that's why I've always had a little bit more empathy for women on the health realm, because their body is much more sensitive, which is a great thing. It makes them have wonderful characteristics and be able to give life, because it's a very sensitive thing, but then also developing a healthy baby that way. So I just watch when people just generalize things for women and fasting and nutrition and exercise, and it frustrates me a little bit.
Yeah, I can see that. Tell me the documentary that you were a part of with RFK.
Do me a favor. It's embarrassing to tell you this. If you go on Children's Health Defense, you'll see everything on there. I was interviewed on there a couple times.
Okay.
And you'll see the fertility they were promoting their fertility thing, and so they used my clip to be a part of that. And you'll see my interview with one of their
all right.
It's on Children's Health Defense on RFK's website.
Okay. I am going to put all this in the show notes. Your social media, international speaker, best-selling author, founder of At the Wellness Way. All that's in the show notes. I mean, we could talk for hours, but I'm sure you have a line of other important people, really important people to talk to. So I appreciate you carving out this time. Let me just tell you, it was easier for people to reach the White House than it was to get an interview with you. I had to go through a screening. They had to look at my social media. Aaron had to call me on the phone. We had to see if I even could make the cut. I do have to say something about that. I do have to say something about that, because there's a story that you probably don't know about. Okay. It's not a joke. Erin she's in this room right now. She does a fantastic job. I get massive amount of requests every single week. It's going to sound funny. I may seem like I do a lot of social media. That's not my primary thing. Right.
I do have hundreds of doctors, and I open up more offices every single month, which is my major focus, is having the clinical things for people to be able to do. Okay.
Thank you.
And so my time, I really like to spend a lot of time with my docs and train them, stuff like that. But then also being on social media, there's people that don't like what I say, and there's interviews that people don't like that way. So therefore, I've had the FBI show up at my house.
Okay. All righty.
So therefore, I'm very big at making sure.
Does this make me a target after talking to you then? Guilty by association?
And Durang, I will have to say the FBI was very courteous when they showed up that way, but people felt during COVID that I was a threat because I was just talking about immunology, and I was talking about getting your T cells and lab measured that way. But see, they tried to censor you, and they tried to create something. So I'm very particular about it. So it's just that because I love doing interviews, I love talking about stuff. I have enough clinical expertise and enough docs to talk about certain things and stuff, and I stick to what I know and I know well. And so therefore, and no joke, when we do get, I'm not joking, 100 requests every single month. We do podcasts away. And so Erin does a great job of doing background checks and everybody and things like that. So there is a story behind that. So I'm just very particular about those things.
Well, I didn't realize the FBI was involved. I figured there was a story behind it, adversarial perspective, but I didn't know the feds came. So
yes.
Thank you so much
and they
for
found
being
out,
here.
And trust me, they found out I wasn't a threat. They realized I'm great for society. They realized this things. But once again, when you do speak truth sometimes hurts people. Because when I told people that they should actually have their healthcare freedom, And I told people that I will fight for freedom, and I will fight for people's right to do whatever they want. I'll fight for your right to get a vaccine. I'll fight for your right to eat everything bad. I'll fight for your right to eat Doritos every night. I'll fight for your right to be obese and sick. I'll fight for your right for everything that way. That's right. But so therefore, and just because, and I'm okay with your choice, it's just that you also be okay with my choice, not falling into medical tyranny. And as you know, you said you started this back in the 90s. This is not new. Everybody just fell for this one.
Right. Okay, Darren's getting nervous that we're going to get political. We're not. So being here, great job.
No, never political.
Thanks for listening to the Lisa Fisher Said podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fisher Said podcast is produced by ClantonCreative.com.